The Northern Arizona Peer and Family Coalition and NAMI Yavapai County present Mental Health Monday. Youth Services in the North. Our needs being met. Our presenters today are Trish Riner, Northern Arizona Regional Director for FIC, which is the Family Involvement Center, Erin Benjamin, Child and Family Liaison from United Healthcare OIFA Office, and Joshua Napoleon, Children's Behavioral Health Liaison for Health Choices OIFA Office. Akia Compton, Vice President of Programs for MIKID.
Our first speaker this morning will be Trish Riner. Trish is the parent of 3 children. Her oldest son began receiving behavioral health services shortly after moving to Arizona in 1999. So that gives her a few years with the system. She has personal lived experience navigating residential treatment centers and Arizona State Hospital placements. She understands the challenges families face when their children transition between placements in and out of the home. Trish has developed advocacy skills that she shares and models for other parents and caregivers who are currently living a similar journey. She is the regional director, the Northern Arizona Regional Director for Family Involvement Center, fondly referred to as FIC. And I just know that with me chairing the Northern Arizona Peer and Family Coalition, I've had a lot of interaction with Trish, and she's right on the spot in the moment when something comes up for a family. She's reaching out, finding resources, and really advocating. So hats off to you, Trish, for what you do.
Thank you. Well, I think today we're talking about barriers to services, right? So I think I'm old enough to remember when the child and family teams rolled out way back when, and there was a lot of excitement. My son got to be part of that excitement. And it really, really was a beneficial thing because it brought the child and family team really brought everyone involved in our son's life together. There was a spirit of partnership, really kind of how do we meet these needs, whether it was the way we always did services or not. So we really had those opportunities to think out of the box. I do think some of that has gone away over the years. I think that's one of the biggest challenges parents might face right now is the not as aware of what the child and family team is, what it could do for your family. The spirit, I think, has kind of left a little bit of that. So if you're a family member that has got a really good behavioral health home and they know that, and they still embody that spirit of that child and family team, they really do partner with other agencies to bring in all the needs or meet the needs that the kids may have or the family has. I think one of the challenges now is everybody is a little bit on their own and trying to meet those, and parents don't know that there are family run organizations out there like Family Involvement Center or MIKID in Northern Arizona. And so I think if there's a way that we can kind of support some education on getting the word out, if parents could be connected to family runs from the beginning, maybe from intake, I think that would help parents be connected to another parent right away at the beginning of their journey versus at the when they're in crisis. I think that would be beneficial for families to really have that support at the beginning. As far as when I think of the referral, since I've been doing this work, Northern Arizona is a little bit more unique than some of the other areas in the state. We need to have a referral submitted to us by a behavioral health home in most cases. And so we rely on those behavioral health homes to share our services and be willing to do a referral and refer families out to us. And I think that's a challenge as well. I think there's a lot of folks in the behavioral health homes that don't know that there is a family run organization in their area and other parents that they could connect some of their families to. So again, those are, I think, some of the barriers that we have. We do get a lot of referrals from a specific agency in both Flagstaff and Prescott Valley. So that's not necessarily an issue for us, but I think some of the other behavioral health homes, if we could get some better education in there about the values of family support, I think that would be really beneficial.
So the next person is Erin Benjamin, and she is the Child and Family Liaison with USCCCP. She's with the OIFA department with United Health. Prior to her role with United Health, Erin comes from 10 years of working with children and families at provider agencies. Erin has a strong passion for advocating for children within the behavioral health systems. Erin is completing her bachelor's degree in Human Services and will be graduating in early August. In her spare time, she enjoys being with her husband and her 2 little girls. But not only that, but Erin is someone that I greatly admire. She is just kind of starting into the advocacy arena, and she's jumped in with both feet. And I just like to share that I really admire Erin. There's really no right or wrong way to do advocacy, but she seems to be making a great impact on other people. So I'm probably really embarrassing her. But anyway, I just wanted to say that, Erin is one of the young people that we as a community need to be there to mentor, and hopefully she stays in our community. So with that, I'll turn it over to Erin.
Thank you so much. That was wonderful and so kind. So again, I'm Erin Benjamin. I am the Child and Family Liaison from United Healthcare's OIFA team. Children's mental health services is something that's just so important and to me, and I'm so passionate about. And we all know that that the children's services system needs improvement. There are gaps in care. Traditionally, barriers that we've seen are, long wait times between services and appointments, extended wait times to even get our kids into services, capacity issues, high staff turnovers. And UHC really wants to hear from our family members up in the north who are receiving these services for their kids about your experiences, what barriers are being encountered, so that we can really start identifying gaps in care and how we can help. Trish mentioned, the North runs a little bit different. That culture is a little bit different up there. And so I want to be able to hear from our family members up there what that culture looks like, because things may run a little bit differently in the South or the Central region. So how can we make sure that we are integrating into the North appropriately, hitting services the way that they need to be run? And again, I'm really starting to identify those gaps in care, but we can't identify how to fix them if we don't know what they are. So as much family member feedback as we can get is going to help us be able to move forward. One area I think that needs to be focused on really is, again, those more appointments, more services in schools, more referrals to our family runs, and increased awareness of that CFT model, bringing back how do we really let those families know that their voice is the most important on these CFTs, because they are going to be their kids' biggest advocate, and they need to make sure that they know how to do that appropriately, to advocate for the kids, to ask for what they need, ask to the services they need from the agencies that they want their kids to receive services from, and to educate families and other providers on what services are available to those kids up in the North. I think is going to be beneficial for all kids, no matter what health plan they're contracted with or what agency they're receiving services with. So those are really some of the big barriers that we've identified, and really have a need to hear from, again, all those families in the North about the experiences you're having, so that we can work collaboratively across plans, with advocacy agencies, to make sure everybody's needs are being met up North.
Thank you very much, Erin. Very poignant and to the point. All right. So next, I'd like to introduce to everybody Josh Kaapana Napoleon. He is the Children's Behavioral Health Liaison with Arizona Blue Cross Blue Shield / Health Choice, and he's the OIFA, on the OIFA team with them. Josh is a native Hawaiian from the island of Oahu. His father was native Hawaiian and his mother was Caucasian. He takes after his mother, which led to difficult times during his childhood, being discriminated against due to his physical appearance. He participated in peer counseling and peer supports throughout school and worked with fellow students when situations arose. This led him to pursue education in the behavioral health field. He continues to work towards a children's psychology degree. Family and children are the most important thing to Josh, as he and his wife raise 4 wonderful kids. So Josh, I hope I didn't mispronounce your name. And I just want to say, I've known Josh since he first started with, then I think it was Steward. And this was, you have to let me know how many years ago it was, because I got to go up there and meet you in person. And right from the very beginning, Josh was all about what's going on and what can we do. So I'll turn it over to you, Josh.
Mahalo, Lori. Yeah, you said my name perfectly. Aloha kakahiaka, everybody. You know, I've worked since actually NARBA, since it was still NARBA. I started as a member services representative, and very eye-opening, you know, coming into the behavioral health field, working with not just members, you know, but families that were trying to get services, you know, for their children, for their family members, everything like that. And it was, like I said, eye-opening to know that growing up, you know, you think that services are always available, always easy. And it's not so in the North, you know, sometimes, because of the fact that we are a very rural community everywhere. You know, sometimes families have 2-hour drives to receive services. They have, you know, wait times like Erin was talking about, you know, and especially over the past few years, that is something that has increased just due to COVID and, you know, the shortage of workers, of providers and everything like that, you know, has continued to rise, and the need has continued to rise as well, which creates a little bit of an imbalance, you know, when the need outweighs the actual support. You know, one of the things that we have been doing a lot, especially within Blue Cross Blue Shield over the past few years, especially, is we're having weekly vetting meetings with new providers, to bring new providers into the network, to work on verifying that they are appropriate, not just for the members, but they're going to work on a timely fashion, that they're going to have the support within their own system to be able to provide those needs and cover those needs for the members. You know, so that's one of the biggest things that we're doing, is weekly we're having these meetings with new providers. You know, our team is very, very extensive. We have a large clinical team that encompasses, you know, every facet of what children's services should be. You know, we have CFTs and training members that teach a lot of what, you know, Trisha and Erin have been talking about. They go out to the providers, really do the instructional training on the makeup and the foundation of what a CFT is, and to really work on bringing that in education and the format to it so that it's being used appropriately for the members. One of the other things we used to have a CRS liaison. They don't specifically do that, but they still have an intense knowledge of that system and everything that would work with it. We have people that work a lot with the DDD, as they are their new insurance now. We collaborate with all insurances, all OIFA departments. A lot of collab and communication goes into everything that we do. And that's one of the biggest things that we are working towards as an organization, is, you know, being able to work with everybody. We have Care First that's going to be taken over as the REBA at the closer to the end of this year. And our team is in constant communication with Deb Jorgensen and the Care First team to really do a warm handoff, you know, with everything that's going on, bringing them up into the North and showing them a lot of what we do, and bridging that gap for them to the community with a lot of the meetings that we've had. One of the things that I really agree with what Erin was talking about is that shortage. You know, families are waiting extensive amounts of time, you know, not just the children, but the parents as well, you know, if they're trying to get in for appointments. And that's one of the things that even before COVID, you know, we've always in the North had that difficulty of trying to gap, you know. And over time, I think as things start to get back to normal, you know, we're going to start seeing a lot of these cut down a bit. Hopefully, you know, that's what our main goal is, as any sort of provider, to making sure that members are getting their services. That's one of the biggest goals that we have, is just making sure that we can start to bring that time, that wait time down, and provide appropriate transportation, you know, to some of those appointments, because there are those that do need that. So, you know, these are all things that we're working on, and we recognize as things that are needing to be worked on and built, you know, on a constant basis, not just say, hey, you know, we did it, now we're good. So that's one thing that we're always working on.
So Josh, thank you so much. It looks like you guys are really partnering with Care First, and this is what, you know, advocates have been hoping for. So it looks good. We're hearing some good stuff, and thank you very much. And so we have one more speaker, Vice President of Programs for MIKID. Akia Compton has been active in youth services since 1993, ranging from residential independent living, juvenile justice, and behavioral health. Her passion stems from being a youth enrolled in the system. Akia received her BA in sociology and criminal justice from the University of Akron, okay, and her MS in administration of justice and security from the University of Phoenix. Akia wanted to give back to her community and help other youth navigate the system in a positive way. She is also a parent of a child with behavioral health challenges. Akia started her work at MIKID in August 2012, where she is an asset. And I will say she's more than an asset. I have known Akia for a long time, and she's dynamite. I mean, she's a real advocate, and she fights. And thank you so much for what you have done in our children's system over probably 20 years, I guess. Has it been that long?
Then I am one of those youth that started at 18 in the system. So been in the system since, started working in the system as early as 18. Yeah.
Okay, I'm turning it over to you, Kia.
Okay, so, you know, one of the things that you got me in the field is my brother and I were removed from my mother for neglect and abuse. And we were placed with my grandfather, who was 76 years old at the time. And we had some significant behavioral issues. And in our family, no one wanted to help my grandfather with us. They said, you know, those kids are going to be in jail. They're going to be nothing. And so what makes me proud is my brother and I are probably the most successful in our family. So that's one of the reasons why I got in the field, because I wanted kids to know, just because you have behavioral health challenges doesn't mean you can't go anywhere with it. And so that is my motto. We're doing a lot at MIKID. One of the things I am happy to say, we'll probably be the first family run that be doing services in 2 states. And so we're also doing services in Colorado now. And so I'm happy to say that was my dream. It was a dream, but a nightmare at the same time, because it was a lot of work. So I want to shake some feathers up down there too. So I've been at MIKID for about almost 10 years now. MIKID saved my life. I believe even Trish is on a call. Back in the day, Trish, and there was another person that used to work here who helped me as a family member. I didn't know a lot about the system. I didn't know what a family support partner was. And so, hi Trish, I gotta say that. Many funny phone calls for her when my son would do crazy things when we're on the phone. And so, but anyway, my thing is that what I'm finding in the system, and I hope this is the forum to say this, is that we've made this very challenging for family runs, the way the system has changed. And I feel like that it's really going towards very clinical. And I feel like it's taken away from the actual niche of what family support, a family run is. And we're losing workforce behind that. And so MIKID, we'll continue to keep trying to promote that peer ran aspect throughout the state, but we do need to do something on the back end as far as the qualifications and things we need to do as a family run organization and not be compared to behavioral health homes. Because at the end of the day, our parents want to come to a family run setting and not a clinic. And so I'm just going to say that because it's really turning me off now. As far as where the system is going. Other than that, we are still running. We're running fast. We cover the entire state. We're big. We're actually bigger in rural areas. So, for example, some of our largest service sites are like Kingman, Yuma. Actually, Nogales is number 2 now. We've actually really grown in Nogales and Sierra Vista. We're trying to get back in Eager. And so, anyway, I don't want to talk too much, but that's a little bit about me.
Okay, thank you, Akia. I totally agree with you. This whole idea, I think everyone has hit on it, is that family and peer-run organizations do something different, do something unique that's not clinical, that adds to the recovery. And I guess the first question, and then I'll turn it over to Ralph, is to each one of you is, since in Northern Arizona, since a lot of providers were not available, since staff were out because of COVID, why were people not referred to the peer and the family runs as an adjunct to the system?
I can start off because one of the things we were told, we have it in writing, is that that they do the services. And so therefore, we had situations where families were receiving, let's just say, living skills. No, we're going to close living skills out without a CFT, without an formal process, and say, no, we're going to provide living skills. We don't care that they want living skills from you guys. So they were trying, so a lot of services were done within, and parents' voice wasn't being heard. And there was, like I said, there were scenarios where we were already doing the services and they want us to close the services out. But guess what? We became rebellious and we just refused to close services or refused to stop doing services with families. But that's the biggest issue. They were holding services within, and pretty much bullying parents and telling them that they would reduce their respite if they, so we had a lot of that. That's just from us.
Joshua?
As far as that, I haven't heard of that particular issue, but Akia, I know I've worked with you in the past. By all means, if those do come up, I'd love to collaborate with you and work with you on that. That's where especially our clinical team and our member services team would be able to step in and be able to bridge the communication and make sure that some of those, especially from what you were saying, I was already in talks because that's very concerning. That's not something that even the previous health home model was built around and for, and it was not supposed to be happening that way. So that's where I would definitely like to know about that, and I'd like to work with you to make sure that doesn't happen, not just in the future, but work to resolving that, to making sure that the voice and choice of the parents is not being stifled, as that's one of the biggest things that we want to stay away from.
Okay, Josh, I didn't know at the time I was reaching out to somebody from there, but I didn't get any response back to, so I could just talk to you offline and forward you everything that was happening. A lot of it, from my understanding, is because based on the last OIFA meeting that we can do our own service plans and stuff. So I don't know if it's even going to be an issue moving forward now. So, yeah.
But at the same time, especially with what you're saying, that would be something that we want to put on record, especially if it's coming from a provider. Any changes that go on moving forward, we want to make sure it's on record, so that way we can see it, we can be able to look at it and know what has happened to be able to make sure it doesn't happen.
Well, the good thing, Josh, they put it in writing by mistake, so we'll give it to you. So
Trish, that the community has worked very hard on this issue and raised this issue time after time after time. about the lack of referrals from the health homes to FIC, in particular in MIKID. So could you comment on this?
Yeah, I think in I think in Northern Arizona, there's been all the power goes to the behavioral health homes. So if they determine that they do not want to refer out, they will not refer out. And so whether we, then parents on their own have to find their family run. And if they find it, then we will work on behalf of them. We will call OIFA, we will call supervise, we will try and work, and it could take months to get a referral. So I think that's one of the biggest challenges is we do have, there's a handful of behavioral health homes. I know, especially for us, that work really well with us in our areas. And there are others that they don't, they will not refer. And that's the part that's really difficult, because the way the system is set up right now, we rely, or parents rely on behavioral health homes to tell them what's available. There are more than enough families out there that are in desperate need of help, that the behavioral health homes do services. We do family, parent peer services. We have kids that are sitting at home because a behavioral health home won't refer to us because they do the same service, but they're not getting the service. And that's where I think the biggest disservice is, whether that's because some case managers don't even know about us, or they've been told do not refer out, period. So it's really, really frustrating for me, especially where I saw things, with my son years ago. We didn't have services because nobody knew what to do with what we had going on. That's very different now. Now I think people are purposely choosing not to refer out, and we have to have a referral. Even if we do our own assessment, our own intake, we have to turn around and we're supposed to get them enrolled in a behavioral health clinic. That's not family friendly. Why should they have to sit with us for 2 hours to do an intake and then go to a behavioral health home that they don't want to go to for another couple hours for an intake? It's just, they don't have all that time, that extra time that I think the system is making them put in for.
Thank you. Hold on, Ralph, we've got Erin, put her 2 cents in.
I think kind of just circling back to what Josh was saying is, if the agencies are hitting that barrier, or they're being told that, they're not getting those referrals, or the health home is not going to refer for these families, then contacting the OIFA teams and the member services to have us step in to expedite some of that and work with both sides, with the family run as well as the health homes, to get those referrals there, to get those members and services, because that's kind of the bottom line that we're all working towards. So if the OIFA teams and customer service can eliminate those barriers, that's really when, we want you guys to contact us so that we can help bring those barriers down.
Thank you, Erin, for that. I just want to jump in. This is Lori, and having worked in the system for many years, and for a peer run, we see a lot of this. It goes with both the youth and the adult, and it isn't a lack of educating the health homes that there are requirements to do the referrals. It is the maintained culture that we're trying to rearrange up here. It's a matter of the health home knows that they're supposed to do a referral, and yet they refuse to do it. I've been in meetings in the past where staff supervisors said, we're being told not to refer out. It still unfortunately happens, and they've been educated. Veronica put together a great training, went around to the health homes. It isn't that they don't know, it's that they still choose not to do those referrals. So,
well, it's not just additional providers, but the money follows the individual. So it's almost like the health home owns the individual. So they don't want to let them go. So the other piece is, because they haven't referred out to providers, we've lost a lot of providers in this area. Some of it's due to COVID, but most of it is due, like Art Awakenings, wonderful program. I used to work with them. They were run out of town up in Mojave County because they couldn't get any referrals. So we need to change the culture. So Ralph,
Actually, there was something that I think the organization might be very interested in that is occurring in Apache County that I was not aware of before the other day's visit. And that is they have 2 youth-based centers in Apache County. One of them is called The Loft. It's in St. John's. And the other one is called The Lodge. And it's in, it might be Eager actually, instead of Springerville. It might be over the line into Eager, but it's right by the Round Valley High School complex in that area. And these are amazing facilities for the youth to come and spend time in, listening to music, playing ping pong, playing billiards. The one in the Lodge in Round Valley is a new facility, and they actually had a small recording studio in this for the kids to write a song and record it, that kind of a thing. I was just blown away by the fact that these 2 small towns in Northeast Arizona have spent that kind of money and personnel. And a lot of it, I think, was driven by one of the judges in this area, juvenile judges, who was tired of seeing these kids just recycle through the juvie system. And the center, the Loft Center in St. John's, is actually a converted juvenile detention facility. You walk in and you look at it; those are jail doors that you're looking at. Well, it's quite amazing. Something all of you would benefit from coming to Northeast Arizona.
Oh, yeah.
Around up here at what we have. You might even actually learn something about rural Arizona while you were at it.
Good, Ralph.
Oh,
Good.
shut up.
We can always count on you. A couple of things, our chat box is down. So you guys are just gonna have to, raise your hand or whatever and speak. So what I would really like is for especially Trish and Akia to explain what is a family run and why is it different from getting family services in a clinic? Why is it so important to our community?
Akia, you want to go first, or?
Let's flip a coin here. I'll go first. The biggest thing is, when you give family support at, let's just say behavioral health home, I'm just going to use that as an example. That family support partner is part of that clinical team. And so what happens ideally, if you're part of that same clinical team, you tend to go with the flow with that same clinical team, rather I think that puts that family support partner in a position where they really couldn't help the parent advocate because they're part of that team. I think when you use a family lunch, which I usually like to explain it as a third party person who comes in, who's not part of that clinical team, can have a different eye or different mindset as far as what that family may need and what they need to help that family advocate for. So it's almost a conflict of interest to me, honestly, when you have that family support partner part of that clinical team. If you look at SAMHSA, that family advocacy is supposed to be an outside provider coming in. So I believe as a family run, when we come in not only with that lived experience. A lot of family support partners, I'm not going to say a lot of them, some of them they hire don't have that lived experience. I'm not saying all of them, but some of them don't have that lived experience. But again, if I'm coming in and working with Trish, who is a mom, I'm coming in from a different aspect. I'm not part of that team. We're able to talk through whatever mom needs. A mom can advocate, and I'm there to help her advocate for herself. I just think it's just a conflict to me when you have a part of that same team. Personally, that's just my take on it.
So the difference, I think the biggest difference is that we're family run. So family run means that we hire parents and family members to work with other parents, family members, to navigate all the different systems, and we come in to support them. There's a lot of different services that come through, maybe the child gets, but we're there to say, hey, let's go out, let's go get some coffee. How was your day? Are you taking care of yourself? And really, helping the families prepare for any of those meetings, explaining what those meetings will be. We can go to doctor's appointments and helping them with all of that. And again, it does, like Akia said, that would all come from my experience as a parent. So all the things that I needed to learn I would be there to help support another family through. The other great thing is, even if I don't have that answer, we have a whole team of people like at Family Involvement Center. I could send out, emails and get my questions answered. So we will typically be able to find someone who has that answer to a question. And if we can't, we will find it together with the parent. So we have much smaller number of families that we work with. I think when the clinics might have, 25 plus, 25 is probably a low number of families assigned to them or kids assigned to them. We have very low numbers, so that way we can go in and meet with a family. We can meet with you for 2 hours if that's what it needs. And we go in and do those, just, I guess, those other types of things to support a parent that maybe the clinics don't do.
As most of you that have known me, I've gone through, and I mean literally gone through quite a number of psychiatrists and psychologists. And it wasn't until I went to a peer run and started relating to other peers that my experience became normalized. And I lost a lot of that guilt and the stress, and I could just talk to someone without being analyzed or told whatever. And that made a huge difference, is starting to go out with people and doing things and feeling normal within that community. It's rough. It's rough to be a parent or a peer. So Veronica?
Hi, everyone. Veronica Welch. I'm with the OIFA department at Health Choice Blue Cross Blue Shield. A couple of things I want to say. First of all, I want to validate and acknowledge the fact that there are issues with the referral system in the North. I have gone on record before and want to go on record again by saying it is an issue. I agree with Lori. Training and technical assistance and requirements and all of that has been covered. It's just not happening. It's absolutely not. I've gathered a couple of months worth of consistent data that I'm able to take to my leadership and quality management department. So we'll be moving forward, yes. So I want to acknowledge that. Equally, I want to let you guys know that the health home model will be going away as of October 1st. And so it'll be the way things work up north will be more aligned with the way things that are happening around the state. As Kathy mentioned, in the health home model, a member is assigned to a health home, and then that member kind of stays with the health home, as does the funding and all of those things. But that model will be going away. It's important, though, to let everyone know that we will still have health homes all across the state. Health homes are not unique to the North. It was just the health home model that was unique to the North. And I also want to say, in recent meetings that I've attended with other OIFA leads and with peer and family run organizations, there has been issues with referrals and follow-up paperwork for members that are receiving services at peer runs and family runs. And this is statewide. There's definitely an issue in the North. I don't want to discount that, but this is a statewide issue as well. Once we remove the health home model, this issue is not going to go away. So we need to be aware of that. Yes, a battle has been won with the health home model going away, but that does not fix the system. So we all need to work together in really collaborating. Education does need to happen, even though it has been happening. It needs to happen continuously because of the turnover of staff at all provider agencies around the state. But I think it's just really important for us to also be very compassionate and be very aware of change. And the reason why I say this is we've had a lot of change in the state of Arizona. Almost every year, Access has put out a new contract for another change. No shame or blame here. There's just been a lot of change. Our members are confused. They feel very overwhelmed. They are not sure how the changes affect them. So information and trainings and all of that is going to be coming out and has been coming out from Access regarding the changes, from Care First regarding them transitioning to the REBA, one pagers. There's lots of helpful information out there, but we cannot dismiss the fact that our members feel overwhelmed. And when we come to peer and family support services, it is extremely important that we utilize our peer and family runs, because most of the people who are in the system either come into the system during a crisis, or honestly, they just feel hopeless. And we cannot in any way, shape, or form expect them to navigate this system. I work in the system. I've worked in the system for going on 28 years, and I still struggle with navigating the system. So 100%, you guys, I am not going to stand on a soapbox and say everything is great, because it is absolutely not. But I think with all the collective powers that we have in these meetings, all the communication that's happening, and just genuinely the honest concern and caring that we have for our members, because these are our communities. We live in these communities. We are not in Washington, D.C. overseeing something states away. We are here. So let's just continue to have these meetings and to talk about the things that are uncomfortable. But I guess my main point is to make sure that our members do not fall through the cracks, that they have the resources needed, and we will continue to get those out in every way that we know how to do. And the Northern Arizona Peer and Family Coalition and NAMI White Mountain and NAMI Yavapai are a great resource for that. So thank you for all that you do. Lots of changes coming, but we're going to do this together.
So Veronica, that was beautifully put. You hit the nail on the head. It's a culture, and change is difficult. There's so much change. It's just not the stuff we're talking about today. It's also the 988 number. It's just so many things going on. So that's why we're having this meeting today, is exactly that reason, because we have to continue that effort to get the referrals to the peer and the family runs, and to make sure that Access does some oversight. So one of the ways you guys can participate is we are organizing a forum. The date has not been set, but we want to have 1 or 2 large forums in the Prescott Cottonwood area, where peer family members from the DD system, foster care, everyone can come together and talk about what is good and what is not so good, and to reassure people, that things will go on as usual. I can remember when I was at a clinic, the only change when the REBA changed was the sign, was the next sign. I went to my clinic and the sign had changed. That was it. All the same staff, everyone's there. It was just the sign. So another question, we've got about 10 more minutes. 11:30?
Yeah.
Oh, we did?
Yeah, we did have that question still from church about the warm lines and crisis services for youth. But before that, there was one of our audience members had some input as a parent of a child with special needs, and also developmental disability services. So we might, if we can get that person, Zara, to comment on that, because she did have that question, that input that she wanted to give from at the beginning of the meeting.
Yeah, my son receives lots of services and even ESA funding from the Arizona Department of Education. And I pulled together a lot of resources to get him what he needs in the care and the coverage for when I work. And I think the biggest thing that I've experienced in the past 5 years, 5.5, almost 6 years now, is just knowing and having the knowledge of all these things that can be done for him and getting him the proper care. And a lot of parents that I work with don't know a lot about all of the different aspects that they can take advantage of. And I'm really grateful for FIC, because that's how I learned about family run. I didn't even know MIKID was family run until FIC told me that MIKID was a private organization, not public, not something that, DCS refers you out to because it's required or something like that. And I think that's really important for parents to know, is that they have voice and choice in having a family run organization and creating that culture of family support instead of business bureaucracy.
So how has this made a difference for you and your son?
It's a huge difference. He's diagnosed with autism, ADHD, and trauma. So all of the support that I can get and getting him used to like what a regular life looks like instead of scheduling each day around his needs and getting him used to, other people, and doing things, learning ABA therapy. ABA therapy is the best thing he's ever had. Play therapy, it started with play therapy, and the therapist taught me how to do that. And sometimes it's kind of bit me in the butt because that's all he really does. So it really helps him emotionally, I think physiologically as well, and knowing that he can control himself and me helping him teach that to him for him to learn and utilize in times that he's just absolutely beyond himself, and he doesn't know what to do, and being that calm, cool voice of support or just a presence for him, and learning that as a parent was very crucial to his development.
So Zara, did you have to go to a specialty provider for that ADA therapy?
For ABA therapy, it started with KIBAB behavioral services. And then when I got ESA for him, there's a place that I tried to have my son in public school, but it never really worked out. So now he's an ESA contract student is what they call them. He's not homeschooled, but I have his first teacher that we had here in Flagstaff. She was an ABA therapist along with behavioral support resource teacher at the school. And now she provides ABA therapy and tutoring to him, which is like great. And his funding is covering that alone.
What is ADA therapy?
ABA is applied behavioral analysis.
Oh, okay.
Yes.
Okay.
Okay, and that is I'm so glad that you found that. And this is something that I see as chair of the Northern Arizona Peer and Family Coalition, that some families aren't being referred to KIBAB. Some families aren't knowing that that is a resource. And the clinics, they do the best they can with what they have, but their staff are not specialty trained for ASD.
Right. Are you talking about KIBAB isn't specialty
No,
trained?
KIBAB is. But they're a specialty. Are they not a specialty provider, or are they a health home?
I don't think they're a health home. I'm pretty
Right.
sure they're a specialty provider. I'm not sure what the requirements and qualifications are to be sent a referral to them, but my son was sent to them through referral from his pediatrician. So they can receive a referral from the pediatrician.
Okay, and that's interesting, because to me, this referral, I'm thrilled to know it came from the pediatrician, but it needs to come from the behavioral health home. And I think when we look at our needs being met, this is one of the areas where for many kids, the need isn't necessarily being met because they're not getting that referral. And this is something that Erin can look into, and other folks that are in positions. And Josh, did you have something to say about that?
Yeah, so as far as the referral, it can come from your actual physician, because the physician can make the acknowledgement that, hey, there is something here. I want to refer the child out to a specialist to look into the autism spectrum disorder diagnosis. So that particularly doesn't have to come from the health home. It can come from a physician itself. So that's especially how Zara was able to get it. And then that's where it will start going into DDD and everything like that. But that will come from the behavioral health home. But the initial request for a referral can come from a physician.
So I wonder, do we have enough of this type of specialty provider in the north? We have KIBAB, we have what is it? Family Support Services, FSS. Do we have enough of this?
So there are, as far as I know, especially in Flagstaff, there are 2 specialty providers for the spectrum autism spectrum disorder that especially specialize in ABA therapy, OT, and stuff like that. So there are providers. You know, there used to just be KIBAB, but there are other ones as well. So that is something that's being provided. The referral can come from CFSS as well as TGC and Spectrum if the need arises there. But as far as the actual ABA therapy, I believe there's 2, possibly 3 now, if I'm remembering correctly, in Flag. I will make sure to get that information and I can send it to you later.
Okay, so you're talking about Flagstaff, but we've got the whole northern Arizona. You know, we've got all these rural communities, and we have people with these needs in other locations. I see Kathy, you're you know,
Look at
and
Ralph.
you're shaking your heads. I mean, we've got, you talk about it can take 2 hours to get, you know, from where you are for service. And are these agencies, what is their outreach, and, you know, how are we reaching all of northern Arizona?
So as far as, you know, KIBAB, I can reach out to them to see what they are doing. I do know there are a lot of people that are traveling in from, say, Winslow, Page, you know, and that's one of the issues that we've had as far as northern Arizona being a rural community. It's not just, you know, when you start getting into those specialty ones, you know, they have to be specialty trained to know how to, you know, provide the services for ABA and everything. And not all of them are, you know, wanting to move out into those more rural areas. But we are working on, you know, transportation to get them in to those services. Those are covered. So as far as what is outside in like Mojave County, I believe there is one. The last time I checked, I will look into that as well and get you that information. I do not believe there is one nearest to Winslow or those locations. I believe they all travel to Flagstaff.
So what is the mile limit for accessibility or having a network insufficiency? Susan, what is, I mean, I thought it was like 15 miles. So going from Winslow to Flagstaff is a schlep. She's hiding. Where'd she go? She went off.
Oh, she did. I'd like to go back to Josh and Erin and back kind of to the, you know, our needs being met. And Josh, when you reach out to these specialty providers and look at what is their reach, what is their outreach, you know, we always want to be solution focused. And something I haven't heard yet today is, like you mentioned, transportation. Well, some of these kids, they're not just going to get in a vehicle and go somewhere. Part of their, you know, their situation is that's going to be a barrier. What about the mobile units where these specialty providers put together their team, like we did with COVID vaccines? We put staff into a vehicle and we got them to where the people needed the service. Can they develop teams and mobile units and get the funding for it to go to these rural communities and meet with them where they are and do an assessment if that's what needs to be done? You know, start there.
So Erin, if you don't mind, I'm just going to speak real quick to that. My son is also on the spectrum, and he receives services from KIBAB. They come out to my house to work with him, you know, for ABA therapy. They also do OT and other services. They come out to my house. So they do provide those services. Now, one of the biggest things that I will say, yes, as an ACC plan, we do contract with KIBAB, but my son's also on DDD. And a lot of the services he receives go through DDD and the Altex services, you know, so that's where a lot of that falls under. I'm going to be looking into answering some of these internally with what we have, Lori, and I'll get back to you. I'll send you an email on that, on what I find out. But as far as my own personal, you know, situation, which is a lot like what Zara was talking about, those services they do meet you where you are. They come out to my house, they work with my child, and I live pretty far outside of Flagstaff. I live down an 8-mile dirt road. They always come out to my house and they're covered in dirt, so they do a very good job of working with a lot of the families to, be able to work with the children where they are comfortable, where they have, the most of their own feelings to be able to show, these providers what they need to see and work with them on. So, that's speaking personally. I'm stepping out of my hat a little bit on that. And I will say they do a phenomenal job with that. But as far as back into my hat, internally, I know we contract with Kaibab. Veronica even put a little blurb in the chat about it. If there are others in the Flagstaff, Mojave, anywhere in the Coconino area that aren't just Flagstaff, we could submit their names to our weekly provider vetting meeting to work on getting them contracted with us. But if it's a specialty provider for stuff such as ABA therapy and things that fall under the DDD category, that might be out of my purview, but I will try and see what I can do to get that information and pass it along.
Lori, can I just add real quick that sometimes it also depends on the health plan to be able to, which specialty provider you can go to, as well as transportation. So not all health plans reimburse transportation for, like, say, Family Involvement Center to drive a child from here to there or go pick them up for services. Some health plans use a service. So we do not get reimbursed for those kinds of services. So that is also something that could be challenging, especially I live in Paulden, which is maybe 40 miles north of Prescott. No one would come to my house for my son. So all those services that Josh is speaking of, those are kind of in-home services. I think they're offered. I think one of the challenges is the distance in Northern Arizona is very different. So the cost for an agency, if you have someone in Prescott, they have to have enough people to come out to Paulden for that to be able to be beneficial for that agency to keep a staff member. So I think there's a lot of things when we're talking about certain areas might have a really good hold on certain services, but how far do they go out? I think that's a big challenge for us. I think folks that live in Ashfork, they rarely get some services. I know we have staff in Williams, so we go there, but again, those are those hit and miss kind of areas. I think they're all very different. And again, it depends on the health plan that people have.
I really appreciate that. And I see Erin's making notes, Josh is making notes, because these are the folks, that this is where the rubber hits the ground. We're helping them understand what the barriers are, what the needs are, so that they can help move things.
Okay, Ralph.
Yeah, I second the emotion that someone made before about I think it was Lori was talking about the mobile unit. I think the mobile unit could do a great deal for rural Arizona as well as rural America.
Okay, what other questions or comments do you guys have?
This is Trisha. Can I add one more thing?
Always.
I think one of the things that hasn't really been brought up here is when you do have those kids that are duly enrolled, and they may be with United, when they do have something, say, like autism, so they're duly enrolled in DDD and also get services at the behavioral health. I think there's a huge barrier for those individuals getting some of the services that maybe they need. There still is maybe a little bit of infighting on who's responsible to provide those services. The agencies are usually, oh, you're a behavioral health agency, you're a DD agency, and kind of going back and forth with some of that. So I think, for my son, that was always a huge struggle because he had big behavior needs. He had aggressive behaviors and things, so nobody would come out, nobody would do anything with him. And I think I think that's something that still needs to be addressed, because that is something that, although the health plans, they cover these services, agencies provide these services, but again, it's very difficult when you have those two components. They don't always work very well together.
And Trish, I'm glad you raised this, because first of all, it's been a historic problem. I was meetings and access where DD sat on one side, behavioral health on the other, and they would like to reach over and kill each other. So it was very vicious, and this has been going on for years. But from what I'm hearing by some of the providers is that they are hearing through their own data that there is no problem with the DD people getting services in this area. And so, Erin, I'm going to pick on you because that's kind of your area.
No, I mean, the more that we hear that, that is an issue, then that's something we can address. But historically, to this point, we haven't heard that kind of funding has been a battle.
Oh, yeah.
Those services have been a battle. So, if you're encountering that, if your families are encountering that, please have them, again, let their OIFAs know. I will, provide my contact information. They can call me directly. We can talk about those barriers of getting those services and where it comes from.
Could you talk directly with Trish? Have you guys communicated?
Yeah, I can.
Oh, that's right. That's right. You guys know each other. Okay, so maybe Trish, you could share a little bit more about that, because that is a long-term historic problem.
And I think
Yeah.
just because you mentioned that DDD says that there are no issues with that, I want to tell you that we've even taken services off my son's DD plan because we're not going to get them. So we finally take it off the plan, so it looks like he's getting everything he needs, which is not okay.
Oh my God.
So that's what happens to parents. I've had a friend of mine who needed respite nursing only for her daughter, could never get it. And so she never got respite because there was one nursing agency out here, and she couldn't get the services and stuff. So I think that there's a lot of ways that maybe they can go around. The hours might be offered. They can say parents aren't utilizing them. But ultimately, if you have a child that has any type of behavioral need, you're going to have a much harder time getting them any type of services than if they don't have those behaviors. So I'm sure that's statewide, but I know that's in all of Northern Arizona.
This is beautiful, Trish, because I wonder, this is horrible. So they're on their plan, there's certain services, and oh, well, they're too difficult to access, so they're taken off and they're given everything that they're supposed to get. This is really horrible.
Right. And parents, I mean, at some point, parents get beaten down. They lose hope. They're not going to find the service. They are handed a list to call all these people. In the meantime, the school is calling to pick up your child. You have your bills to pay. You have to get to work. And now you have to call this multiple pages to find someone who's going to come out, to maybe do some services for you. So it's really, really challenging for parents to be able to do all of that.
Okay, so I see that we've got Lori Douche from MapForce, which I participate, and Becky Lane. And I was wondering if you guys might share a little bit. One of the things I met with some people from Lori and I met some people from the health department the other day, and we realized the pillars, that the information isn't really being shared between like the health department. They have their initiatives and, like the behavioral health system. And this is very different than it is in Maricopa, because I was with both the health department and Access, and there just wasn't any communication. So anyway, I was hoping maybe I hate to pick on you, but maybe you'd like to share some of the feedback from today and how this might impact your program.
Hi, this is Lori, and I'm looking at it specifically from the narrow sequential model work that's going on in the schools, and also with our Kinship Care Coalition, because we're training folks to do the narrow sequential model for caregivers. And so what I'm looking at is through that model, which is Dr. Perry's work, and you'd have to go on and read all that. So it's evidence-based. And what comes out is folks, the teachers that we've been training, this will be our 3rd year with really ramping that up, you know, are coming across youth who need this support. And we also have the trauma lens care working in schools and the police departments. So a lot of it has to do with the students and the families that need support around kiddos who are dysregulated. And it can be from trauma, it can be from a developmental delay of some sort. And how do we get the information out to them and help the families, but also within the school system, help the schools understand a little bit about where that student can be coming from, give them the tools to work with the kiddo, and then link them back to more services. And so that's what I'm looking at is, you know, what is out there? How does it work when we're presenting to the teachers, because we already have 21 trainings lined up with schools in our county. I'm from Yavapai. What resources can we provide to those teachers so that then they can refer out? But then the flip side is when the student is recognized, they don't want to be labeled by going to any kind of behavioral health. And so there's a lot of work that still needs to be done in providing that support and those services in a wraparound process that keeps them engaged, keeps the families engaged, you know, why it's important, gives them the tools. So that's the programming that I'm working with. And I'm not even going to go into the prevention within the schools. That's a whole nother conversation.
Okay, so is there any way with Akia and Trish that you guys might partner and have further discussion and reaching out to the schools?
Right now, I'm building the game plan for the next round for this grant that I work under. And so I just actually did reach out to Zara to have her come and speak with the kinship work group, because those agencies, and there are many of the partners that are in the room, work with families that have adoptive, foster, kin care, you know, in their home. And I would like her to share, you know, how she has expanded the reach. So I'm going to work with her, and that'll be the beginning conversation. So yeah, that was my sidebar conversation with her.
Very good. So, you know, that's part of what we're trying to do is promote partnerships and really expose people what, you know, MIKID and FIC can do. And also NAMI is bringing Ending the Silence to Yavapai County. And so that's a big initiative that we're working on. Hold on just a second, Ralph. There's one more person I haven't picked on, and that's Lori. Oh, then it's Becky. I'm sorry, it's Becky I haven't nailed.
Good morning. I've been listening. I'm sorry, my camera's off. We're doing some wrap services and I've got a kiddo mulling around. So, but I've been listening, and I'm pretty shocked to hear some of the history that's gone on. I worked in community mental health, but this is a new venture the last 3 years and into extended leadership. So I do acknowledge my ignorance of a lot of history that's happened in this area, and that I don't know why some practices are the way they are. I didn't know it was possible to say, no, we're not going to refer to a service. No, you can do that. I can tell you on our end, it's primarily been administrative, lack of administrative support in getting referrals and all the paperwork and all the follow-up done. At least just here within my department, right here in Cottonwood, Arizona. There, you know, Spectrum's expanding to different areas as well, but personally, it's been manpower and knowledge. A lot of knowledge is lost with turnover. A lot of knowledge is lost without, you know, manuals and so on and so forth. And so I really rely heavily on the health plan and their updated provider listings. I have Mercy Care Bibles and Health Choice Bibles all over with all the different providers in the area, but really the relationships that we have with FIC and with CFSS and the other providers in this area are what we've been relying on. But that's slow inertia, that's slow going when you're trying to learn and you've got new
Well,
staff.
maybe
Yeah,
Becky,
so-
you can get in there now that you've been enlightened and ensure that some referrals get over to Fick and MIKID.
Yeah, I don't know what health homes are. No, we're not. I understand if you can provide the service, then you should provide that opportunity for the client to decide, but you also ethically at that first session are supposed to be providing them with education on how to be smart consumers of mental health services
Exactly.
in the area. So what I'm not understanding is where is that falling through? But I can tell you what we're doing and how we're helping to bridge that gap just with the education and the coordination of care between the agencies. So what have we done? There was a huge need for a single office that had a single email and a single phone number. That was the coordination of care office for the kids team, where all referrals, requests, as well as if I have care managers that need to crank out a bunch of FIC referrals or meet me where I'm at, that those CFTs have already occurred. I'm reviewing those treatment plan updates to make sure that they do meet medical necessity, that it's documented, that this is a client choice. Can we provide skills training? Sure. However, we're not gonna, we've got great providers, but no one's gonna be able to touch what FIC does, for example, with parent support. And if that parent wants skills training for their client and some group work here, and additional parent support services, then that meets medical necessity, and that's where you have the BHP come in and look over all of that, make sure it's dialed in. But so we've had this coordination of care office up and running for a little bit over a year, and a lot of good has come out of it, but it's still trying to turn something like that around and streamline it, because none of us share the same EHR has been challenging, but we're starting to crank out more and more referrals in a quick, timely manner.
Okay, Becky, we're out of time.
Oh, I thought we had until noon.
No, and I wish we had more time.
Oh, got it.
But
We'll get those referrals out. That's all I can tell you.
No,
Not saying no.
you are a gem in this mess. And so I'm asking that you and Akia, especially you and Trish, because she's in this area, you guys get together. I mean, you are I don't know what you call them, but one of those leaders for our people. You're in the system, and you know the value and you know the ethics. And this is so wonderful to hear. So I'm serious. So if you guys could maybe have some conversations, do you know how to get hold of each other? Okay, will you
We
do
have
that?
meetings scheduled already.
Yeah, Trish, I think we're meeting twice a month.
Yeah.
Okay. Oh, Becky, this has made my whole day.
And a special thank you to all of our speakers today.
So thank you so much.
Thank you, guys. Bye-bye.
Bye.
Bye.
Thank you for joining NAMI Yavapai and the Northern Arizona Peer and Family Coalition today. For future events, please go to namiyavapai.org. Thank you.